Respiratory 202 Chapter 21. Thoracic organ transplants. The first heart transplant was in South Africa. The first lung transplant was in Mississippi. In 2010, more than 500 pediatric heart transplants were performed. 126 pediatric lung transplants were performed. And less than 100 heart-lung transplants worldwide were performed. Heart transplant complications include premature coronary artery disease or coronary vasculopathy. They can cause ischemia, arrhythmia and sudden death, and can be avoided with immunosuppressive regimens. And hypoplastic left heart syndrome, which is more common in neonatal transplants. Heart-lung transplants were offered for end-stage pulmonary disease patients before lung transplants were developed. They decreased by more than half since the late 90s. A lung transplant with repair of the congenital heart defect is preferred for patients with ASD, VSD, PDA and pulmonary hypertension from Eisenmenger syndrome. Lung transplants. Patients who need bilateral transplants may have cystic fibrosis, pulmonary hypertension, interstitial lung disease, pulmonary growth abnormalities and bronchiolitis obliterans. Survival after 1 year is 85%. Survival after 5 years is less than 50%. Death in the first 90 days is usually from ischemia-reperfusion injury. Other causes include airway anastomotic dehiscence, massive hemorrhage, infection, multi-organ failure and acute graft rejection. It is difficult to find a matching size and an available donor. One possible solution is an adult lower lobe donor. Survival and quality of life. Heart transplants have a greater than 60% survival rate after 10 years. Lung transplants have less than 40%. Lung transplants have higher function and quality of more than 85%. And heart transplants have a function of 60%. General complications regarding respiratory. Possible reduced thoracic compliance and compromised cough and deep breath due to thoracotomy tubes and incisions. Myocardial failure which will require ECMO with or without a vent. Also capillary beds are more susceptible to ischemic injury than other organs. And a reperfusion injury occurs in 10 to 20% of lung transplants. General complications regarding rejection. In cardiac there may be decreased contractility, CHF, tachycardia and tachypnea. In the lung there may be tachypnea, inspiratory crackles, increased interstitial infiltrates and hypoxemia. General complications regarding bronchiolitis obliterans. It is a late complication of lung and heart-lung transplants. Causes include chronic rejection, infection or aspiration. General complications regarding drug toxicity. There is a higher risk of infection from using immunosuppressors. Cyclosporine and tacrolimus have the highest potential. Prednisone complications are most common during immediate post-transplant period. General complications regarding infection. It is hard to tell infection from rejection. And the lungs are more susceptible to infection due to contact with environment. General complications regarding other. These include obstructive sleep apnea, cerebrovascular accidents and aspiration.